Bismillahirrahmanirrahim. Assalamu alaikum. A 44-year-old woman has come to the office with a 6-month history of painful sexual intercourse. She has no associated itching or abnormal vaginal discharge. The patient has never had these symptoms before and has no problem with sexual desire or orgasm. She has been monogamous with her husband for 15 years. The patient's menstrual history periods are irregular and are not associated with unusual pain. She has no urinary or gastrointestinal symptom. Her medical history is notable for mild hypertension that has been well controlled with dietary changes and exercise. The patient has no history of pelvic inflammatory disease or gynecological surgery. Her only medication include a daily multivitamin and a saline eye drops for chronic dry eyes. The patient does not use tobacco, alcohol, or illicit drug. Temperature is 36, blood pressure 136/88, and pulse is 72, and respiration are 12 per minute. The neck is supple. The patient has mild dental caries. Chest auscultation reveal no abnormalities. The abdomen is soft and non-tender. Pelvic examination show normal appearing external genitalia and a dry vaginal mucosa. The uterus and adnexa are normal with no cervical motion tenderness. Which of the following is the most likely cause of this patient's current condition? So this patient is a 44-year-old woman. She came to the office with a 6-month history of painful sexual intercourse. She had no problem with sexual desire or orgasm. Her only medication include eye drops for chronic dry eyes. The patient's neck is supple and has mild dental caries. Pelvic examination revealed dry vaginal mucosa. Based on these hints, the diagnosis of this question is Sjorgen syndrome. And here the correct option is choice C, inadequate lubrication. So patient having Sjorgen syndrome, which is autoimmune disorder of the salivary gland, which causes the patient, as this patient having dry vaginal mucosa, which is due to the inadequate lubrication. The other sign and symptom of the Sjorgen syndrome include adenitis, sialoadenitis with an inflammation of the salivary gland, keratoconjunctivitis, Zika. Extraglandular manifestation include arthritis, rhinite phenomena, dyspareunia, vasculitis, interstitial lung diseases, and non-Hodgkin lymphoma. Come to the incorrect one, endometriosis. So patient with endometriosis having pain with deep dyspareunia, but this patient doesn't having the history of amenorrhea, making this diagnosis unlikely. Choice B, estrogen deficiency. So estrogen deficiency, the patient will have dyspareunia, but the patient will be postmenopausal. This patient is premenopausal, making the diagnosis unlikely. Choice D, interstitial cystitis. So patient with interstitial cystitis present with chronic pelvic pain, urinary urgency, and dyspareunia. Choice E, lichen sclerosis. So lichen sclerosis may present with dyspareunia but typically causes valvular itching. Choice F, vaginismus. Vaginismus is dyspareunia due to muscle spasm that prevent vaginal penetration. Choice G, vulvodynia. So vulvodynia is a cause of painful entry dyspareunia. Physical examination show pain to superficial touch of vaginal vestibule rather than dryness.